Hello and welcome to the programme. A Kiev court has ruled to reinstate Ulana Saprun as acting health minister of Ukraine. Now, to give you some background, on February the 5th, she was temporarily removed from office due to her dual citizenship. Since the government's approval of Dr. Saprun's healthcare reform package in late 2016, the Ministry of Health has implemented a host of reforms that not only improve the quality of medical services, but also address the entrenched problem of corruption in the medical field. Now, I'm pleased to say, to talk more about this, we are joined in the studio today by Valeria Rachinska, who's the head of regional policy team of 100% Life NGO. Hello, thank you so much for coming in.
Hello, thank you so much for inviting me.
You're welcome. So, Ulana Saprun, really, since she's taken office, she has achieved an awful lot, considering the pressure that she's under from different groups, whether it's a particular oligarchs or particular parliamentary committees or perhaps even political forces. So the latest episode that we've seen with the Radical Party MP, Ihor Moseichuk, bringing a case against her. My first question is, why now in particular?
Because, right from the start, when she started to be a Minister of Health, in 2016, she got a lot of pressure from the politicians, from the oligarchs, from all types of people who are involved in political life in Ukraine. Why? Because she stopped a lot of corrupted schemes. She do not want oligarchs to steal money from Ukrainian citizens, and she really motivated to change everything. So she provided a lot of reforms, and one of these reforms, it's medical reforms, the reform of primary health care in Ukraine. So, and of course, all people that stopped to receive their money from these corrupted schemes, of course, they don't like her, they don't want her, and they want to replace her. But she has a strong support from the President Poroshenko and from our Prime Minister Volodymyr Groysman. So it's not so easy for them, but they don't want to give up, because they were stealing about 800,000 millions per year.
Wow.
Yep. On all this procurement. And she stopped it. Yeah,
I was going to ask you actually whether you could give some examples of the certain corruption schemes that she has stopped.
Because everything, the most simple things, it was tenders. And when this games was dishonest, and it was the same people, the same organizations that with different names was applying on the same lots on tenders. So, and all people that have to win this, they did it, and they got all this. They was doing all this government procurements for Ministry of Health, and they were more than happy. So when we started to have this new system Prozoro, it's reduced everything. And but the biggest actually win, it was procurement through the international organizations, through UNICEF, through Crown Agency, and through UNDP. And we started to save right from the start, from the first year, 40% of all budget of Ministry of Health.
That's incredible. Yeah. Wow.
Yes. Yeah. So corruptioners have no one particular reason to like her, really.
But what achievements do you think she has done in terms of ordinary patients who need treatment for perhaps cancer, who need treatment just for basic problems?
Okay, the first very important thing that she created, it was the electronic register of patients. Why it's so important? Because first time in all this more than 20 years of independent Ukraine, we started to understand how many patients we really have. And for example, with people with diabetes of the second type, it was 40,000 fake patients. So, and we, like taxpayers, we were paying for their medications. The second, this electronic register of patients, started to be not electronic register. The list of available medications started to be available on in all clinics.
Oh, so it was open to everyone to see.
Yeah. It's like an e-medication system. Okay, for example, I'm in Kiev, I need medications from hospital number 2, and I can check it in internet, which kind of medications they have, how much, and actually it's reduce all corruption for such a low level, so it's nearly impossible to steal.
Because if it's on the list but it's not in the hospital, then you can instantly find out where it's gone.
Of course, and I can have a questions. Okay, you have it. Where is my medications? Then she started to provide this e-health system, electronic register of all patients in Ukraine. Because for this moment, before Uliana Saprun, actually in this country nobody knew how many people we have in our healthcare system, and it was like a huge field for different corruption schemes. Because if nobody knows, we can write everything.
And is that to do with people registering with their local doctor? Because this has been a big thing.
Yes, this is a big thing because we actually stopped this slavery. Because I have 2 kids, and my kids, they are like regular patients. They have no insurance from my company. They don't. So all the services that they have access to, this is services, medical services from the government, like a normal clinic, normal ambulance, and. Before this reform, I shouldn't actually had no opportunity to choose doctor because I had my registration, and if I go, for example, for other city,
then
it was possible to have access to services. Yes. Nobody tells that your kid cannot have the service, but I have to pay for that. And for me it was question why. I already paid my taxes. Why, if I not in Kiev, for example, today, but in Lviv, and my child need, I don't know, consultation of medical doctor, general practitioner, why I have to pay? I paid already.
Do you think that's actually quite a big problem as well? The fact that perhaps not just in major cities like Kiev, Lviv, Odessa, Kharkiv, but in the smaller towns and perhaps even villages, that people still have to pay for medical assistance, although they are taxpayers.
And this is an issue because, if you, for example, wasn't paying for directly into the hospital, sometimes it was unofficial payments to the pocket of doctor or medical staff, so on. And now, with all this reformation of medical system, we will stop it because if doctor will really have normal salary, why he needs some unofficial payment? He don't need because before this, it's I don't know. We maybe just one country in all Europe, whereas medical doctor after 7 years of education and spending a lot of issue to get this education and so on, have salary about 150 euro.
After 7 years of education.
Yep.
Wow.
Our regular doctor, it's like that.
So it wasn't necessarily because there was an opportunity to take extra money. It was because there, in a lot of cases, not every case obviously, but in a lot of cases, it's because the pay was so bad.
Yes, it was one of the reasons because why our system was so corrupted. And for example, could I judge these people, these doctors? No. I can understand because they need eat, they need sleep, they have kids, and it's kind of to survive with this money. So it was like for them it was like for just life savings, unofficial payments. But now Uliana stopped it because doctors really can just do their work and have a normal salary. So no chances to have this kind of corruption.
I want to talk actually more about Uliana Saprun's work because she was appointed in 2016 and since then she has held 2 roles. She's the Deputy Minister of Health and also the Acting Health Minister. So do you know any particular reasons why she hasn't been appointed officially as the head of the Health Ministry?
Corruption. Again, the reason, just one reason, corruption, because she's doing really well. She's really have a spirit of fighter. She's fighting for life for all Ukrainian citizens. And of course, corruptioners don't want her. And that's why she's still acting
But surely there must be a case against these people who are bringing cases against Ulyana Saprun, where if you don't have an acting health minister or a health minister, then treatment for a lot of people who perhaps want treatment abroad, for more expensive treatment, they can't get it. So what happens in that situation then if you don't have a health minister?
But, okay, the first question about some humanity from these people. Do you really believe that they care about just simple Ukrainian citizens? Okay, they're ready to block everything, block vaccination, treatment for really people that need treatment on the broad of Ukraine. They are ready to stop all procurements just to remove Ulyana from all this picture. So, and when the people, after this telling that they really care about Ukrainian citizens, it's not care. It's not care, it's they just want to manipulate of opinion of people just for their own interests. So what can I add to?
Yeah, and one final question, actually, unfortunately running out of time, but what does your particular organisation do to perhaps raise awareness of her work, or are you involved in this? I see you have the T-shirt.
Yes, of course, because the biggest value for our organization, just one value for our organization, it's life. And we can do everything to save lives. It's just one mission of our organization and our mandate. And with Ulyana, we have the same vector of development. So we will support her in all things that she will do, because she's doing really well things. The first time in a lot of years, all people living with HIV, all people with tuberculosis, all patients of opioid substitution therapy have access to treatment, and their needs covered 100%. So it's never been done before. And so in Ukraine we have officially registered 144,000 HIV positive people, and she covered every need of these people with this. This is the result. The same I can tell this way they act about patients with cancer and so on. So she really fight for life with us.
Yeah, and we know that recently as well, the judge who was presiding over this case has recused himself. So we're going to see what happens. Thank you so much for coming in to our studio. It's very interesting.
Thank you. Yeah, thank you.
That was Valeria Rachinska. She's the head of the regional policy team at the 100% Life NGO. Thank you for watching, and stay tuned with UATV.